History taking is one of the most crucial skills in clinical medicine, particularly in the FCPS Medicine Part 2 exam. A systematic, professional, and empathetic approach to history taking can make a significant impression on the examiners. This process not only demonstrates your clinical acumen, but also highlights your ability to connect with the patient. Begin by introducing yourself to the patient in a polite and professional manner. Establishing rapport is the first step to ensuring the patient feels comfortable sharing their concerns. Start with basic demographic details, including the patient's name, age, gender, and occupation. These initial pieces of information set the context for the case. For example, age often correlates with the likelihood of certain conditions, while occupation may hint at lifestyle-related risk factors. After gathering basic information, move on to identifying the chief complaint. This should be recorded in the patient's own words to reflect their perspective. For example, if a patient says, "I have been feeling breathless for 2 weeks," note it down exactly as stated. The chief complaint provides the starting point for further exploration. Once the chief complaint is identified, proceed to the history of the presenting illness. This is the most detailed section and requires careful questioning. Begin by asking about the onset, duration, and progression of symptoms. For instance, inquire whether the symptoms started suddenly or gradually, whether they have been worsening or fluctuating, and whether any specific events triggered them. Dive deeper into associated symptoms by asking open-ended questions. For example, if the patient complains of chest pain, inquire about its location, radiation, nature, intensity, and any factors that relieve or aggravate it. This focused approach ensures a comprehensive understanding of the patient's current problem. After addressing the presenting illness, move on to a systemic review. This step involves exploring other body systems to uncover additional symptoms that may not be directly related to the chief complaint but could still influence the diagnosis. For example, in a patient with fever, ask about respiratory, gastrointestinal, or neurological symptoms to ensure no significant detail is missed. Next, focus on the patient's past medical and surgical history. Ask about any previously diagnosed conditions, hospital admissions, or surgeries. For instance, a history of diabetes, hypertension, or ischemic heart disease could provide important clues to the current presentation. Don't forget to ask about any allergies or previous reactions to medications. The family history is equally important, particularly for identifying hereditary or familial conditions. Inquire about illnesses in immediate family members, such as diabetes, hypertension, or cancer. Social history is another critical component. Ask the patient about their lifestyle, including smoking, alcohol consumption, diet, and exercise habits. These factors often play a role in disease development and management. For example, a history of smoking may point to respiratory or cardiovascular issues. Medication history should not be overlooked. Ask about current medications, including prescribed drugs, over-the-counter remedies, and traditional or herbal treatments. Check for adherence to prescribed therapies and any side effects experienced. Medication errors or non-compliance are common reasons for treatment failure. In an exam setting, presenting the history to the examiner is just as important as taking it. Use a clear and structured format when summarizing the case. Begin with the patient's demographic details, followed by the chief complaint, history of the presenting illness, systemic review, past medical and surgical history, family history, social history, and medication history. Highlight any red flags or significant findings that could influence the diagnosis.